Hi everybody, Tom Barnes, stories from the 78 here in Westtown at Case Integrative Health. And you might ask yourself, what exactly does integrative health mean? Well, it's kind of this philosophy of taking all of what we know about health and medicine and kind of blending it all together and trying to perhaps use other avenues outside of using steroids or pills or what have you. There's other ways to do things, and this is a spot that will allow you to pursue other ways of healing ailments that you've had, from dealing with chronic fatigue or with some sort of disease or even bad knees like me. You can get it all here. I'm going to talk to Dr. A about what this place is, how it can help people, as a different form of medicine right now, from this story from the 78 here in Westtown. All right, so I made my way back to Dr. A's office. How you doing, Doc?
I'm good. How are you?
I'm doing well. I have been here before, and it's been a while for me to come back here. I love doing a story here at Case. You've been here for about a year, though, right? Just
Yeah, a little bit over a year.
So you're board triple certified, right, in the medical world, and you are now in integrative health. Can you just talk a little bit about what that means exactly, though?
Sure. So, integrative health or integrative medicine, the way I like to think about it is basically using the best of what we have in our Western allopathic world for medicine and combining that with other whole health systems. So, that could be different ways that people practice medicine across the world, essentially, and putting it together to come up with the best possible treatment plan for a patient.
Literally like integrating different medicine philosophies, but a lot of the things that people have historically said, non-traditional, but it is traditional medicine. It's just not traditional here in the States, perhaps, right?
Yes. And also even just looking at ways to practice medicine outside of what we would do routinely in a hospital. So more in a functional way.
And this is something that goes back to you as far as growing up. You said you spent some time with your grandparents in India, where a lot of the practices that we use in the non-traditional medicine here in the States comes from that part of the world, though. And that had a big influence on you of kind of found your path to end up where you are here today.
Yeah, I think just growing up around immigrant parents, I was exposed to going abroad quite often and exposed to the way people live their life and they operate in a functional way, meaning that the things that they're doing in their day-to-day life are actually in order to keep themselves healthy.
Right.
And I
There's
think
purpose.
there's purpose. And so I was always drawn to, oh, you can naturally heal your body. And as I've come to practice medicine over the years, I've found that the body has an amazing innate ability to heal itself. We just need to provide it with the right tools, which I think is not just limited to what we do in the hospital.
Right. You even mentioned just watching your grandmother make her morning routine of lemon water and pepper, or your grandfather, you mentioned doing yoga, which here in the States, even like up until a few years ago, hearing like grandparents do yoga or any of that mindful stuff was just so foreign. And that's what's so great about a place like this, where you've kind of found that calling early on in your life here as a profession, doing that kind of non-traditional, I would suppose, medicine, but it's not. It's all together, and that's part of like what you're doing here.
Yeah, I mean, it's just, my grandfather, he had a family of five to raise. He was a single income earner, got diagnosed with type 1 diabetes pretty early on, and he had to find ways to optimize his health span, not necessarily have this really, really long life, which would be limited by
Sure.
having a chronic disease, but how to be healthy and for the life that you're having. And so incorporating very basic daily practices really does have a compound effect.
And that's what you guys do here overall. Like, it's just giving people other ways that maybe perhaps traditional Western medicine won't give you. That's what people can explore here, like including like what I even did with my knee. Walk me through that procedure that we just did with my knee, because I have old man knees. I'm in my early 40s, but I have old man knees, and this is the procedure I had done was something just a little bit different than maybe going to a traditional Western medicine doctor, right?
Yeah, so I'm always looking to provide people with sort of a longevity lifestyle. So, what can we do now that's not going to impact you negatively in the future? And so, I think in my world, we've tended to go straight to a steroid injection whenever there's joint pain anywhere. And the problem with that, and we know now that it's clear, getting repetitive steroid injections over years and years and years is just, it's not helpful to you. It's not helpful to your
Right.
body.
It's part of like the American problem of popping pills for every little ailment we have, right?
Absolutely. And steroids are great when you need them, and they should be reserved for when you absolutely need them. But in the meantime, we have other therapies and interventions that we can draw on. And one of those is prolozone, which we did on you. And that's something it's been used more in an a-traditional setting. But someone like me who can use ultrasound and give you an injection that works very similar to a steroid injection without giving you the steroid, I think is a great way to go. And we're not limited by only being able to do a few a year.
No, and it was really painless, honestly. I mean, people, have their different opinions about needles, but it was super easy. It didn't hurt. And that's like the baseline to what other procedures that you can have done if you want to do things further for further or severe symptoms, right?
Yeah, so the way I think about regenerative therapies for what we do in pain management and how we inject different areas of the body is, a lot of people are talking about PRP or platelet-rich plasma, which is a great intervention as well, and stem cells would sort of be the next in the hierarchy of ways to go. But prolozone is a great way to just start out with if you're not sure if you want to proceed with those, or it depends on how bad your injury is, where you are in your kind of level of pathology. But basically with prolozone, it's almost exactly like you're getting a steroid injection, but instead of getting steroid, we're going to give you a mixture of local anesthetic plus some nutrition for your joint, cartilage, tendon, depending on where we're doing it. And then we're going to give you a mixture of oxygen ozone. And that works as a proliferative or regenerative agent, but you're not using cells from your own body. It's an outside agent, ozone.
And that's just one of the spots you can have this procedure done: knee, back, neck, wherever, really, a tennis elbow. Like, there's different therapies for different, or the same therapy can be used for different parts of the body.
Different parts of the body. Yep. And the reason why ozone is so potent is we think it actually stimulates the stem cells in that area to come in and do whatever it is that they're going to do, whether it's strengthening the tissues, stabilizing the ligaments, increasing blood flow, improving oxygenation, getting rid of oxidative stress, which is often a cause of trauma over time. And so it's a potent therapy. It's been used across the world for many years very safely. And so I'm just excited that we can offer that therapy here.
And so people want to learn more about what you guys do here or set up an appointment. Pretty standard how to do that. I'm guessing going online and getting all that information online and doing it that way.
Yeah, they can call the office. They can set up a discovery call, find out a little bit more about it, and then set up an appointment. We run more of a boutique practice, so we like to accommodate people when they call.
Awesome. Well, I'll have people ask for you specifically who have watched the video, just
Yeah.
because you've been wonderful. I can attest. Thank you very much for your time, Doc. I appreciate it.
Thank you for visiting us.
Absolutely. All right, so that is the story from this 78. What neighborhood are we calling this? Is this like Westtown?
Westtown?
Yeah, this is Westtown. That's what she says. TomBarneyChicago@gmail.com or storiesfromthe78.com. Thanks again, Doc. I appreciate it.
Thank you.